Hi, we're here with Drew Schiller, co-founder and CTO of Validic. Can you briefly explain what Validic does and how it fits into the healthcare ecosystem?
Sure, so Validic connects patient-generated digital health apps, wearables, in-home medical devices, standardizes and normalizes the data and provide one connection to the healthcare system. So hospitals, CIOs, CTOs, when they're looking at their device protocols, they don't have to worry about which blood pressure monitor to give to patients. They just have to worry about that blood pressure data is coming in. So a patient can use a blood pressure monitor from Omron or A&D or Withings or iHealth or Cardio or whatever, and the data comes through in the exact same format every single time. However, it is sourced by manufacturer.
We've seen Validic a lot in the news lately. There's been a number of announcements. You recently announced clients at Cerner and MEDITECH. Can you tell us a little bit about what they're doing and how you're fitting into their mobile health data into EHRs?
Sure, absolutely. So Validic is being built into the patient portal for both MEDITECH and Cerner, and so patients can actually engage with the physicians through that portal and connect the devices through that. And once they've actually taken readings with those devices, whether it's a blood glucose meter or a blood pressure monitor or a fitness tracking device, the data goes into the patient portal and then all the way through to the EHR. So the physician can actually interact with that data and it becomes part of the permanent medical record.
How do you see your role in fostering innovation in digital health?
We actually have a new product that we just released called Validic Connect that allows for app manufacturers and device manufacturers to send data directly into Validic in order to access our customer base. So one really quick example is a company called SunSprite that tracks sunlight, and so it's for persons with seasonal affective disorder. And so one of our customers said that they would like to get the data from that, so SunSprite built a connection to Validic, took about a week, and now that data is flowing through Validic, and anytime a patient is wearing the sunlight tracker, the data flows seamlessly through our system and back into the healthcare system.
There's been a lot of talk recently about healthcare information interoperability. That's one of our more popular phrases. What's Validic's view on the current landscape and where are we in the industry as a whole?
The biggest opportunity that I see in interoperability in healthcare actually has to do with our opportunity in digital health. So we have an opportunity in digital health to actually create a healthcare system that is from scratch effectively, that is interoperability by nature, by default. And in fact, Frost & Sullivan just last year recognized Validic as a leader in healthcare interoperability for our work in digital health.
In addition to being a co-founder of Validic, you're also the CTO. How are CTOs thinking about the speed at which technology is changing the healthcare industry?
The one thing that CTOs are really looking to do is try to understand what to do with all this data and then actually how to make it actionable, because patients are certainly bringing these devices into the hospital and into other healthcare organizations, and we need to actually make this data actionable. One thing that I'm doing is sitting on boards with other CTOs and CIOs with the Consumer Electronics Association and the eHealth Initiative, and we're trying to look at policy and other governance measures within this industry to help make the data flow a lot better and have more data liquidity.
Thanks, Drew. This was really interesting.
Thanks, Eric. I really appreciate the opportunity.